Bismillah ar-Rahman ar-Rahim. Welcome to my channel Science of Life with Dr. Muhammad Yusuf. Today I'm going to talk about classification of anemia. Last time we discussed the general things about the anemia. We'll classify anemia, different types of anemia we are going to see. But before that, one hadith I would like to quote. Huzur Sallallahu Alaihi Wasallam ने फरमाया, लैसा मिन्ना मन दरबल खुदूद वशक्कल जुयूब वदा बिदावल जाहिलिया। वो शख्स हम में से नहीं जो गमी और मौत के मौका पर अपने रुखसारों पर तमाचे थप्पड़ मारे। होता है ना हमारे यहाँ, जब मौत हो जाती है तो लोग अपने मुंह अपने आप को पीटने लगते हैं, तो ये सख्त नापसंदीदा है। हुजूर सल्लल्लाहु अलैहि वसल्लम ने फरमाया कि वो हम में से नहीं है जो अपने रुखसारों पर ऐसे मौके पर तमाचे मारे और मुंह पीटे और अपना गिरेबान फाड़े, कपड़े फाड़ने लगे। वशक्कल जुयूब वदा बिदावल जाहिलिया, और जाहिलियत के तरीके पर शोर शराबा वावेला करे, हाय हुई ताड़ा लूटी, ये शोर शराबा करना ये जो है ये नापसंदीदा है। ये हुजूर सल्लल्लाहु अलैहि वसल्लम हम में से नहीं, उसका मतलब ये नहीं है कि वो काफिर हो जाता है। वो ये कह रहे हैं कि हमारा तरीका नहीं है, यानी वो हमारे तरीके पर नहीं है। मुसलमानों का तरीका यह है कि कोई नुकसान हो गया, कोई फौत हो गया, तो उसमें इन्ना लिल्लाहि व इन्ना इलैहि राजिऊन, हम अल्लाह के लिए, अल्लाह की तरफ जाने वाले हैं, सब्र की दुआ करें, आसानी से कंपोज लें। और दुख तो है, दुख तो नेचुरल बात है, लेकिन उसमें ये तरीके इख्तियार करना, दुख तो कम नहीं होता अपने कपड़े फाड़ने से, दुख तो उधर ही रहता है। तो कंपोज एंड मैनरिज्म सिखा रहे हैं, तो ये अल्लाह पाक हमें समझ अमल की तौफीक अता फरमाए। So today I'm going to talk about the classification of anemia. Most of the books, they give this classification on this slide. I'm going to talk probably in Pakistan, most of the students, they study the physiology that by Guyton and Hall, and which the classification is given like this. That is, the one is blood loss anemia, then there is aplastic anemia, and then the megaloblastic anemia, and then the hemolytic anemia, like this classification. So I am going to discuss the another classification which will include this, and there is, for example, there is deficiency of if there is something wrong with the kidneys, the person will be suffering from the erythropoietin deficiency, and the person will be suffering from anemia. This classification does not cover that. So I will classify. This will be included in that classification, which I am going to give the classification. These are 4, and we are going to 6 or 7 types of anemia we are going to talk about. Now here in this classification, blood loss anemia, when the blood is being lost, the person acute loss, or in the previous lecture we talked about acute loss or the chronic loss will cause the anemia. And if something wrong with the bone marrow, aplasia of the bone marrow, anemia will occur. And if there is deficiency of vitamin B12, or there is another condition which is known as the pernicious anemia, absorption of vitamin B12 does not take place, that will result into megaloblastic anemia, and then the anemia resulting because of the destruction of the RBC, different condition. We will see in that my classification will include these 4 types of anemia as well. Now anemia, we defined it in the previous lecture, that is quantitative and or qualitative deficiency of RBCs. That is, either the quality of RBCs is wrong, something wrong with the quality is not good, or quantity is deficient number of the RBCs. So there may be decreased number of RBCs or decreased amount of hemoglobin, or both. Both may occur, and or I have written here. So there will be decreased number of RBCs or decreased amount of hemoglobin, and or both, and this will result into the decreased oxygen carrying capacity, and this is anemia we classified. Now my classification will be like this, that is nutritional anemia. Some nutritional deficiency that includes iron, that includes zinc, that includes cobalt, that includes vitamin B12 or other requirements, that includes protein deficiency, that will result into decreased amount of hemoglobin. So nutritional anemia due to any deficiency of any this dietary substance, and the person is suffering from the anemia. And then pernicious anemia. This is a type of anemia in which vitamin B12 becomes deficient, not because of the deficiency of vitamin B in the diet. It is the deficiency of absorption, something wrong with the absorption process. That is, the stomach produces an intrinsic factor, that a chemical, a compound which is helpful for the absorption of the vitamin B12. If that is deficient, if the stomach mucosa is atrophied, that factor will be deficient and the vitamin B12 will not be absorbed. It is available in the diet, but it will not be absorbed. So this type of anemia is known as pernicious anemia. Then aplastic anemia, of course, that is bone marrow, something wrong with the bone marrow. Bone marrow is not producing the normal required amount of RBCs, aplastic anemia. Then renal anemia, that is something wrong with the kidneys. There will be deficiency of erythropoietin. You must be remembering the lecture on erythrogenesis, production of RBCs. Erythropoietin is produced from the kidneys because of the hypoxia. Hypoxia results into the production of renal erythropoietic factor and then erythropoietin, which is responsible for the stimulation of the erythrogenesis or RBC production in the heart. So when there is something wrong with the renal failure, so you will see many chronic renal failure patients, they do suffer from anemia. So that is known as renal anemia. Then the blood loss anemia, hemorrhagic anemia, of course. That is the classification also given by Guyton. Blood loss anemia, acute blood loss or chronic blood loss, that will result into it. And then hemolytic anemia, when the RBCs are being quickly destroyed. There may be many types of the hemolytic anemia, but RBCs are destroyed. 1, 2, 3, 4, 5, 6. So and then congenital anemia, that is the seventh one. That is the hemolytic anemia, it may be congenital. There are hemolytic anemia may be congenital, but hemolytic anemia, maybe there are some acquired causes of the hemolysis as well. So the congenital anemia, that is. So these 7 classifications, these 7 anemias will cover all the anemias we come across in our practice or practical medical field. Now I'll just explain all these one by one. Nutritional anemia, deficiency of any nutritional. We discussed the requirement of hemoglobin formation or RBC formation, some vitamin, some iron, some cobalt, some zinc or proteins, etc. If there is deficiency of any one of those, the person may be suffering from the anemia as well. So nutritional deficiency, and commonly it is the iron deficiency, very common anemia in our part of the world, in this subcontinent, India, Pakistan, Bangladesh or Sri Lanka. This is the most common anemia we come across, that is the iron deficiency anemia. Iron deficiency may be due to decreased availability of iron in the diet, decreased intake of iron in the diet. Of course, our diet are deficient. We have got poverty, poor people, the proper standard diet is not there, so iron deficiency may be there. So there may be decreased intake of iron in our diet, or there may be some abnormality of the intestine, proper absorption of the iron is not taking place. So iron deficiency because of the decreased absorption of the iron. And then blood loss, chronic blood loss. Acute blood loss, if it occurs, that also causes the anemia, but that acute blood loss may be replaced if other things are okay, then it is. But the chronic blood loss, there is something wrong with the intestinal worms, for example. Enterobius vermicularis, a common intestinal worm which causes sucks the blood from the intestine, and that causes chronic blood loss. Enterobius vermicularis, that small intestinal worm. So that causes the iron deficiency. And so chronic blood loss because of this, or some peptic ulcer, some ulcer in the intestine, or some diabetic ulcer on the skin, as well as some bleeding is taking place daily and blood is being lost daily, and that will result into the deficiency of iron. Because blood is being lost, hemoglobin which contains the iron is being lost. So the chronic blood loss results into the deficiency of iron. So the R, sometimes this iron deficiency becomes evident when there is more demand for the iron. For example, in pregnancy, in pregnant lady, she is taking normal iron, etc., normal diet. She was not anemic before pregnancy, but during pregnancy, a new human being is being, tissues are developing, blood is developing, muscles are developing. All those will need iron. The baby also needs a lot of iron is required. So if that is not supplemented, the pregnant lady's diet is not supplemented with the iron, then she may suffer from the anemia. So increased demand of iron, for example, during pregnancy. So number of cells may be normal. Now sometimes if there is iron deficiency, usually there is microcytic anemia, but cells may be normal, of normal shape, but the hemoglobin content is less. Cell size may be normal. It may be smaller or may be normal. The number of cells may be normal, maybe normal, or maybe number of cells, sorry, not size of the cell. Number of cells, this bullet is explaining. Number of cells may be normal. 5 million per cubic millimeter. Okay, this is normal RBC count in normal male, or 4.7 million per cubic millimeter normal count. This is normal. But if there is deficiency of iron, so this is she or he is suffering from the anemia. Number of cells may be normal or may be more than normal, but the person is still suffering from anemia. Number of RBCs may be 6 million without hemoglobin. The person is anemic. Number of RBCs is more, normal or more than normal. The anemia will be there. So decreased iron, cause of anemia is decreased iron will result into decreased hemoglobin. HB stands for hemoglobin. When iron is deficient, that heme part of the hemoglobin, that will result in decreased heme part and decreased formation of hemoglobin. And when the hemoglobin is less in the RBCs, size of the RBCs may be smaller. It is usually microcytic. If it is acute blood loss, then it is normochromic, but the normocytic. But if chronic blood loss, chronic deficiency of anemia results into the decreased amount of hemoglobin in individual cell, or the hemoglobin is 35% of the cell is hemoglobin normally. If this 35% is deficient, the size of the cell will be smaller. So microcytic anemia usually occurs in iron deficiency. So decreased iron also results into the decreased color. Of course, hemoglobin is the color in the RBCs, so it is hypochromic as well. We classified it in the previous lecture. It is hypochromic. So iron deficiency anemia is hypochromic microcytic anemia. Hemoglobin, chrome color is also deficient and size is also smaller. So iron deficiency anemia is microcytic hypochromic anemia. This is not physiological, this is physiology. We discuss the normal mechanisms. So this deficiency, we can understand, this is the pathophysiology. We can understand this on the basis of our physiological knowledge of physiology. But we do observe in the clinical classes, you will see, when you go to higher classes, third year, fourth year, final year, you will see the patients, and the iron deficiency anemia patient have got the brittle spoon-shaped nails. The nails become brittle, and there is depression in the center of the vein, we term as spoon-shaped nails, and this term is known as chylonychia. Chylonychia, this is quite common in iron deficiency anemia. So in nutritional deficiency, I'm going to show the slides of iron deficiency anemia. Then the opposite, the megaloblastic anemia. What is that? The cell size becomes bigger when it is due to dietary deficiency of vitamin B12, or there is deficiency of intrinsic factor, or there is deficiency of folic factor. Vitamin B12 intrinsic factor, I'm going to explain what is this intrinsic factor. And folic acid. Folic acid and this vitamin B12, both are vitamins. These both vitamins, folic acid as well as the vitamin B12, cyanocobalamin. The name of the vitamin B12 is cyanocobalamin. Cyanocobalamin and folic acid both are vitamins. Both are required for the proper maturation of the RBCs. In the DNA maturation process of the maturation of the RBCs, and if these both are deficient, it is known as maturation failure anemia. Excuse me. So it is maturation failure anemia. The cell size is usually bigger if these are deficient. This intrinsic factor is concerned with the absorption of vitamin B12. This intrinsic factor is produced by the stomach mucosa. If there is atrophy of the stomach, something wrong with the stomach, and atrophy of the stomach mucosa occurs, there is the source of the production of this is not there, intrinsic factor, and this vitamin B12 will not be absorbed. It may be present in the diet, but it will not be absorbed. The result will be this maturation failure anemia or megaloblastic anemia. This is known as maturation failure anemia. The cells are usually bigger. Macrocytes, megaloblastic anemia. Blast cells, usually we call them when there is immaturity as well. Maturation failure anemia we are talking about. So cells are immature as well. That was we call them as blast. So megaloblastic or macrocytes, bigger cells or megaloblastic anemia it is known as. The cell membrane of these cells is abnormal in the sense that it is easily rupturable. It is fragile. They easily ruptures when it passes. These cells, they are bigger as well. The cell membrane is also fragile compared to normal RBCs. So when this bigger cells, they pass through the tight areas in the circulation, especially in the spleen, there is rupture, easy rupture of these cells. So there will be destruction of these cells and the person will be suffering from anemia. So hemoglobin contents of the individual cell may be normal or maybe more than normal. Individual hemoglobin cell is bigger, nothing wrong with the hemoglobin synthesis. Iron or globin, etc. is okay. It is the maturation failure. Hemoglobin is being produced normally. So hemoglobin contents may be normal or maybe more than normal individual cells. So more than normal amount of hemoglobin may be present because the cell is bigger. So but the person the cells easily rupture and the person suffer from anemia. Pernicious anemia is what? It is, I will go again to this slide, it is deficiency of this one. This is the megaloblastic anemia, not due to the deficiency of vitamin B12 in the diet. It is due to deficiency of this intrinsic factor, and the result will be the deficiency of vitamin B12 that we term as the pernicious anemia. So pernicious anemia is megaloblastic anemia, vitamin B12 deficiency, but the cause is the atrophy of the stomach mucosa or absence of that intrinsic factor which is required for the absorption of that vitamin B12. So pernicious anemia, it is an maturation failure anemia, and there is decreased vitamin B12 due to the poor absorption from the GI. And the cause is intrinsic factor from the stomach that is deficient, decreased intrinsic factor from the deficient. Autoimmune destruction of the parietal cells in the stomach, they are responsible for the production of this. Some autoimmune process, we'll discuss the autoimmunity. You may not be knowing very basic knowledge. Immunity destroy the foreign invaders, but sometimes immunity may develop against the body's own tissue. That is known as autoimmune. So body own tissue are being destroyed, stomach mucosa is being destroyed by our immune system. That is abnormal. So autoimmunity against the parietal cells will result in the deficiency of intrinsic factor, and the person will be suffering from the megaloblastic anemia, which is termed as the pernicious anemia. Or atrophy of the mucosa will occur because of maybe of this, or if the stomach has been removed surgically. If nothing wrong with this autoimmune, but this is everything is okay. But if some operation has to be performed on the stomach and the stomach has been removed, so there is no availability of parietal cells. So intrinsic factor will be deficient. So the gastrectomy is surgical removal of stomach. Gastrectomy means gastrum is stomach, ectomy means cutting of that or surgical removal of that. Gastrectomy, that is surgical removal of the stomach, will result into this absence of intrinsic factor and pernicious anemia will occur. So anemia is maturation failure anemia, megaloblastic anemia, macrocytic anemia, cells are bigger. Cell membranes are fragile, easy rupture, we have seen in the previous slides as well. Now this slide, this is the bigger cells, that is macrocytes. Macrocytes, that are macroavulocytes. Ovular, they may be ovular like macrocytes and they are egg-shaped. So macroovular, macrocytes, circular or maybe ovular. So macroovules are macrocytes. So in this pernicious anemia, vitamin B12 dietary deficiency or folic acid deficiency will result into this picture of the RBCs. Iron deficiency anemia, as I was saying, I will show the slide. This is the iron deficiency anemia. What is that? Hypochromic microcytic anemia. Cell size should be small and the color of the cell. That is the dietary deficiency of iron and the poor absorption of iron. We have described it, chronic blood loss and decreased iron, decreased heme. We have described it, and decreased hemoglobin and decreased size of the cell and microcytic hypochromic anemia will occur. ये पहले देख के आ गए हम, and this is the picture of that. The cell size is, this is normal size, this is smaller size. Normal size is 7 to 8 micrometer. We discussed in RBC probably. That is 7 to 8 micrometer is, so if they are less than 7 micrometer, 5 micrometer, size is smaller. So microcyte and chrome is deficient, hypochrome. Hemoglobin color is deficient. This lighter area in the center is more than the normal. So this is the microcytic hypochromic anemia in iron deficiency. This is another slide. Large number of RBCs, but you can see all the size of the cell is smaller, and especially the chrome is deficient. They are the hollow rings. Only rings ring-like structures are visible. These are RBCs, deficient hemoglobin content, lighter area has increased. So this is the microcytic hypochromic anemia in iron deficiency. This is again hypochromic anemia. Okay, these are the WBCs. We are going to talk about WBC in next lecture, inshallah. You will become familiar with these cells as well. Now you can see here the size of the cells. You can see this is 7 to 8 micron. So this cell will almost double than that. So size of the, we will talk about the size of WBCs in next lecture, inshallah. Now the aplastic anemia, that is bone marrow aplasia. Destruction of the bone marrow due to any cause will result into the decreased production of RBCs, and that is known as aplastic anemia. Failure of bone marrow to produce RBCs. And the aplasia of the bone marrow is maybe due to bone marrow destruction by different causes. What are maybe the causes? Decreased number of all the blood cells. We are going to talk about what are the causes of the bone marrow destruction. So there will be decreased number of all the cells produced in the bone marrow. WBCs are also produced in the bone marrow. Platelets are also produced from the bone marrow, and RBCs, of course, they are produced from the marrow. So all the cells decrease, all the cells of the blood, all the formed elements will be deficient. So RBCs are deficient, WBCs are deficient, and platelets are deficient. All the cells, so that is why it is also known as pancytopenia. Pan means all. Cyto means cells, penia means deficiency. So deficiency of all the cells, all the three types of the cells in the blood, RBCs, erythrocytes, leukocytes, and the thrombocytes. All the cells are deficient. So this is pancytopenia. Now the causes of the bone marrow destruction, as I said, why the bone marrow? Radiation, for example, very commonly X-rays may destroy. Very frequent exposure of the X-ray is alarming. Frequent X-rays, gamma rays, nuclear bomb explosions, Chernobyl or Hiroshima or that Nagasaki, where the nuclear explosion took place, the people suffered from the bone marrow destruction, and many people died of this because of this severe destruction of the bone marrow as well after the blast as well. So the radiation by X-rays and X-ray radiation or gamma radiation or nuclear bomb explosion causes the destruction of the bone marrow. And then the chemicals, some chemical may cause the aplasia of the bone marrow, benzene containing compounds. And contain benzene. Arsenic, that also causes destruction of the bone. Chloramphenicol, very commonly, it was used, now it is not very frequently used, a drug which was very effective against the typhoid fever. Typhoid fever, this chloramphenicol was very effective. And this, but it had the side effect of bone marrow aplasia, bone marrow destruction. So the person on treatment of the chloramphenicol typhoid patient suffering from the typhoid, using this chloramphenicol, one has to keep an eye on the hemoglobin contents or the RBC production or the bone marrow functions. So chloramphenicol, very effective drug, but it has got the side effect of bone marrow destruction. Quinine, a drug used for the malaria as well, quinine. And quinine, that also destroys the bone marrow. Gold salts. Some Hakim, they use gold salts. This gold is bone marrow depressive. It causes the aplasia of the bone marrow. Benzene, of course, it has been written. And radium also destroys radiation. So these chemicals, they can destroy the bone marrow, radiation and the chemicals. Then some bacterial toxins, they also destroy the bone marrow. For example, typhoid, tuberculosis, this bacterial toxin, bacterial toxin, for example, typhoid disease is itself the cause of typhoid disease, salmonella causes bone marrow destruction as well. And the most of the infection, there is increased number of our WBCs. Usually we see increased number of WBCs. We are going to talk about the WBCs, white blood cells, in next lecture, and immunity. There is usually, whenever there is infection, there is increased number of WBCs. But in typhoid infection, there is decreased number of WBCs. This bacteria, the typhoid bacteria, Salmonella typhi, that is known as, that causes some toxins which are responsible for the suppression of the bone marrow, aplasia of the bone marrow may occur. Tuberculosis infection, sometimes the bone marrow is invaded by the TB. The TB, those bacteria are the bacilli, those are known as bacilli, and TB may cause the absence of the bone marrow, destruction of the bone marrow, and it will cause the anemia. HIV infections, that also suppresses the bone marrow. That HIV, AIDS, bone marrow depression is there, and that may cause the anemia as well. There is the decreased number of WBCs as well as the RBCs. So invasion of the bone by other cancer cells. Cancer anywhere in the body may invade the bone marrow as well. Other area, that is known as metastasis. Cancer anywhere may cause the may migrate to other areas. You will study in your pathology classes or in your higher classes. And so this bone marrow may be invaded by the cancers, and cancer cells are the abnormal proliferating cells, and they destroy the whole of the bone marrow. They take place, they cover all the area, and that is the invasion of the bone marrow by the cancer cells, which will cause the bone marrow destruction. Or chemotherapy for some other chemotherapy for cancer. Chemotherapy for cancer may cause the destruction of the cancer as well as the bone marrow. Chemotherapy has to be taken place, so that chemotherapy kills the malignant or cancer cell, but that some normal cells, even bone marrow cells, may be destroyed. So all these are the causes of the bone marrow destruction, and that they may result into the aplastic anemia. Now renal anemia, the another class of the anemia. Renal anemia, we know the renal kidneys produce erythropoietin. If something is wrong with the kidneys, if the kidneys are not normal, they are non-functional. Then the renal diseases, chronic renal functions. And the chronic renal failure, not function. Chronic renal failure may cause the decreased production of erythropoietin, and erythropoietin, as you know, very well know, it is required for the proper production or genesis of the RBCs, erythrogenesis. So erythropoietin deficiency will lead to decreased production of RBCs, and this anemia will be known as the renal anemia, and it is very common. You will see in the person, elderly people or even young people, if they suffer from the chronic renal failure, there may be anemia is one of the features of that chronic renal failure. Now then the hemorrhagic anemias. Bleeding anemias. If bleeding occurs, of course, anemia will occur. If there is acute blood loss, the person will be suffering from the acute deficiency of RBCs. Or if there is chronic blood loss, then the anemia will be there. So there will be acute blood loss anemia. This classification, of course, given in your Guyton and Hall. That is the anemia, acute blood loss. If I bleed now, if some injury occurs, I bleed now, I will be suffering from anemia, but nothing is wrong with the normal size of the RBC. RBCs in my blood, they are normal, so it will the acute blood loss, the cell size is normal, and the cell color is normal. The remaining cells are normal, but the total number has been reduced because of the bleeding. So this is acute blood loss anemia, is normocytic, normochronic anemia. Only the number of the cell has been reduced. Count has reduced. Hemoglobin, total amount of hemoglobin in the blood, because the blood is diluted with respect to the number of RBCs. So the total amount of hemoglobin, normal amount of hemoglobin is 16 gram per deciliter. It will be less than 16 gram, maybe 10 gram per deciliter or 8 gram per deciliter. So this is the normal. Cells are normal. All these cells are normal. Nothing wrong with the cells. Shape of the cell, size of the cells, chrome of the cell, color of the cell, it is everything normal. Only the number of cells will be less. Then chronic blood loss. As I said, there's some ulcer, some bleeding spot in this intestine, some bleeding spot anywhere in the body. Chronic blood loss is taking place, and this is the microcytic hypochromic iron deficiency anemia. Like picture will be simply as the iron deficiency anemia. We have seen this slide. Decreased number of RBCs, decreased size of the RBCs, decreased amount of hemoglobin, etc. And this picture we have seen already. That is microcytic hypochromic anemia will occur. And so normochromic, hypochromic cells, these are the normochromic cells, these are the hypochromic cells. The filling, these cells are filled with the hemoglobin, a small light area, but these cells are deficient by the hemoglobin. The lighter area has increased. Then the hemolytic anemias, anemia in which hemolysis occurs. Hemolysis means breakdown of RBCs. Normal RBCs, they are broken down normally after 120 days. But if they are destroyed before that, before that age, the hemolytic anemia will occur. For example, very important, not common, but very important hemolytic anemia is this erythroblastosis fetalis. This is an anemia of a newborn baby. Severe anemia of the newborn baby. The baby may die if it is not properly handled. Erythroblastosis fetalis. That is the hemolytic anemia. I am going to describe it. Then the another hemolytic anemia is sickle cell anemia. That abnormal hemoglobin results into the sickling of the RBCs, and RBCs are destroyed easily. So hemolysis does occur in the sickle cell anemia as well. And then the congenital spherocytosis. Cell size, they are, instead of being biconcave, they become spherical. Congenital, this is congenital genetic abnormality, and that causes those cells are easily destroyable, easily rupturable. They pass through the tight space with great difficulty, and they are destroyed easily. So congenital spherocytosis. Then hemolysis, these are the erythroblastosis. I am going to explain all these three. And hemolysis may occur due to some other causes as well. For example, infection like malaria. You must have studied the malarial parasite cycle somewhere, maybe in your pre-medical classes. Malarial parasite destroys the RBCs. So malaria and septicemia may cause some infection in the blood, may cause the destruction of the RBCs, hemolysis of the RBCs may occur. Infections like malaria and septicemia. And chemicals like lead and hemolysins. There are some chemicals, hemolysine, which any chemical which causes the lysis of the RBC, they are known as hemolysine. So some hemolysins, maybe hemolysine, some snake venoms, they hemolytic snake venoms are there. Some poisons maybe become hemolytic. And the agglutinins, we are going to talk about what are those agglutinins. Blood group, we are going to talk about the agglutinins. These are the antibodies which cause the agglutination, clumping together of the RBCs, and finally destruction of that. That also causes the hemolysis and breakdown of the RBCs. So jaundice is when the RBCs are being destroyed by this sickle cell or congenital physosis or by these chemicals, because the RBCs are being destroyed. RBCs contains hemoglobin. Hemoglobin will be degraded into many chemicals. One is bilirubin will be formed. Bilirubin is formed. Yellow pigmentation, pigmented that pigment produced by the degradation of hemoglobin, that is known as bilirubin. In hemolytic diseases, jaundice is common. Jaundice means yellow discoloration of the sclera or the skin or whole of the body. That is more accumulation of bilirubin. So in all hemolytic anemias, bilirubin level may increase and it may cause jaundice. Now I'm going to explain these one by one. That is erythroblastosis fetalis, which I said it is not very common but very important. That is erythroblastosis. What is fetalis? Fetus ki disease. What is that? That is when our RH, we are going to discuss the blood groups. One type of blood grouping is RH blood grouping. And we classify this RH blood grouping into negative and positive. Negative people, positive people are those which contain the RH factor. Negative people are those which they do not have RH factor. So mostly 85% of the world population is mostly, it is RH positive and only 15% are negative. Different countries have got different ratios of this negative impact. Overall, it is about 85% of the world population people, human beings are positive and 15% are negative. Who are positive? Which contain the RH factor. RH factor. I'm going to explain when I discuss the blood groups. RH stands for the rhesus monkey. That agglutinogen was originally found in the rhesus monkeys. That's why this term has given to RH factor. So RH, if the mother is RH negative, what is meant? She is among those 15% people who have got no agglutinogen, no antigen. We have got the normal antigen, blood group antigens. RH is a normal antigen in my blood. B antigen is, I am B positive. I have got the B antigen as well as the RH antigen. So those are the normal. So she is otherwise normal. She has got some B group or A group or O group, whatever, AB group. But the RH group is deficient. That is, wo nahi hai. She is normal. She is not, this is not the abnormal. She is amongst those 15% normal women, but she is RH negative. But if she marries a RH positive man, then the RH positive gene is Mendelian dominant. If it is the father's gene is transmitted to fetus, the fetus will become positive. Will be positive because the father is positive. If that father has transmitted this gene, RH gene, to fetus, fetus will be positive. Now this mother is negative. Fetus is positive. Nothing wrong yet. There is nothing abnormal that when this fetus, if the mother is exposed to, if his mother is not exposed to RH positive blood before that, nothing going wrong. It will be okay. This baby will be born normal. Mother will be deliver this baby okay, nothing wrong. But during delivery process, Normally in pregnant lady, there is no mixing of the fetal and maternal blood. Mind it, there is no direct mixing of the fetal or maternal blood in the womb of the mother. They are separated by the placental membrane. Only nutrition crosses across the placental membrane, gas exchange takes place. So there is no mixing of the blood, positive or negative blood. But when the baby is being born, placenta is being broken down from the wall of the uterus. There are chances that from the placenta, the fetal positive cells may enter into the maternal blood. So mother receives cells which contain that protein, that antigen, which is not the part of the mother's body. So she will take it as foreign protein, and her body, her immune system will respond in the form of the production of antibodies against this foreign protein. Rh, which is a normal in me and all the positive people, in that fetus positive baby as well, it is normal, but it is abnormal protein for that mother. If that protein has entered into the maternal blood during delivery, now she is exposed to this Rh positive abnormal protein. Her immune system will be alarmed, and her immune system will produce antibodies against this foreign protein. What is that? Rh positive cells, Rh positive protein, antigen usko कहते हैं. So the mother exposed to positive cells during first delivery. Now she is exposed to this, and she will start developing antibodies against these positive cells. Okay, this baby is normal. Your first baby born is normal, nothing wrong. Usko to kuch nahi hua. But when the next pregnancy occurs, and the next time again the positive fetus develops, there is no mixing of fetus blood or maternal blood, but antibodies produced in the mother, which have been produced in these 1, 2, 3 years pregnancy. कितने बाद देर बाद हुई है दोबारा. So but she was producing antibodies against the Rh positive cells which were not there in mother. मदर में अगर फीटस के जो दाखिल हुए थे 1 menials and they have been discharged, वो तो खत्म हो जाएंगे उनकी अपनी लाइफ स्पैन. मदर कैन नॉट प्रोड्यूस पॉजिटिव सेल्स, but she has produced antibodies against those positive cells, and next pregnancy, when the next pregnancy occurs, those antibodies will be crossing the placenta. Blood does not cross, but antibodies they cross. Some antibodies they cross. These antibodies cross. These are smaller antibodies. They can cross. They cross in the placenta, they enter into the fetal blood, and fetal is producing the positive cells. Those positive cells will be destroyed by those antibodies. So baby will be suffering from anemia. Baby cells will be destroyed by the antibodies coming from the mother. And the baby will be suffering from severe anemia during intrauterine life. And the baby may die in the intrauterine life. And if it is, the baby may be born, if it is not properly handled, I'm not going to touch that handling process. Baby ko kaise handle karenge? But you can imagine if this baby is born, maybe it had to be handled that she or he will be very severely suffering from the anemia. RBCs are being destroyed. So severe anemia in the subsequent fetus will occur, and the blast cells will be present. Abnormal, immature cell will be. Whenever there is excessive demand for the more production of the RBCs, even the immature cell, in the lecture on the RBC production, I discuss it. RBCs enter from the bone marrow into the blood at the stage of reticulocytes. So, but if there is excessive production, excessive demand, even immature cell, blast cells, for example, the normoblasts, or the polychromatophilic erythroblast, may enter into the blood, and blasts are present in the, and that's why it is known as erythroblastosis fetalis. This is the picture of that. This is RBC. There should be no nucleus. Normally, RBCs is like this, but here hemoglobin containing RBCs, hemoglobin is there, it is visible, and nucleus is also visible. So the person has got the blast cell. These are the different blast cells. This is WBCs. Different. This is also WBC. So these are the blast RBCs, immature RBCs. They have entered into the blood because of the severe demand on the production of the RBCs. So even immature cells. So this is known as erythroblastosis fetalis. So I will explain in more detail. I will discuss it when I discuss this RH blood grouping. That is, we will discuss the blood groups as well. I will discuss this disease in more detail there. But this here only as one type of erythroblast. Now the RBC is one thing left. Yes. Why it is I have included this in the hemolytic anemia? These RBCs are being destroyed. RBCs are being attacked by the antibodies, and those antibodies causes the agglutination, and these RBCs are being destroyed. So it is a hemolytic anemia. RBCs की destruction जारी होती है because of this. So it is a part of the hemolytic anemia. Next hemolytic anemia, sickle cell anemia. That is, it is also known as drepanocytosis or sickle cell anemia. Sickling of the RBCs occurs. That is, sickle cell anemia results from a defective gene coding for the abnormal hemoglobin called the hemoglobin S. We discussed the formation of hemoglobin alpha chain and beta chain. Usually alpha chains are normal, beta chain is defective. What is that defect? There is a hemoglobin S has single amino acid substitution in the beta chain. At beta chain and there is a long chain of the amino acid. At position number 6, glutamic acid is substituted for valine. Only one amino acid. Only one amino acid is substituted. Only one amino acid is different. Rest is everything okay. But the properties of this hemoglobin becomes different from the normal hemoglobin. What is that property? This abnormal hemoglobin S can carry oxygen, all right? No problem. It can carry oxygen. It can combine with the oxygen. It can deliver oxygen. But if this hemoglobin is exposed to low oxygen tension, hypoxia due to any reason, hypoxia, decreased oxygen concentration, this hemoglobin will crystallize. This is abnormality. On exposure to hypoxia, this hemoglobin S crystallizes, and crystallization of this hemoglobin, precipitation of this hemoglobin causes deformity of the RBCs. Shape of the RBCs become sickle shaped, we are going to see. So the valine is substituted for glutamic acid at position number 6. I have explained it. And the low oxygen is responsible for the precipitation and crystallization of hemoglobin S, and the RBCs are destroyed. So when they crystals, they can break the RBC's membrane. So hemolysis will occur. Sickle cell disease crisis, vicious cycle. I will explain it. Vicious cycle, what is that? Now let me explain it there. If I am suffering from sickle cell anemia, my RBCs contain hemoglobin S, it is all right. It is taking oxygen from my lungs, delivering to the tissue, all right. But if due to any reason, if some disease of the lungs, if I go to high altitude, hypoxia due to any cause, if there is hypoxia due to any cause, I suffer, my RBCs will become crystal shaped, and they will precipitate, they will crystallize, and there will be increased destruction of the RBC. Okay. And I will suffer from anemia. No. It will continue. How? That is, I have suffered from hypoxia due to high altitude, for example, or due to some lung disease. If hypoxia and some crystallization of, say, the 10 million RBCs have been crystallized, for example, or 10 billion RBCs have been crystallized. So, because of the destruction of the large number of RBCs, hypoxia will be aggravated. This aggravation of hypoxia will further cause the destruction of the crystallization, precipitation of the more RBCs, and this becomes a vicious cycle. So it has to be stopped. How it can be stopped? Oxygen has to be given. Oxygen will stop, or you will have to give the substitute the blood as well. But oxygen saturation, hypoxia has to be treated very quickly. So vicious cycle may kill the person. Hemoglobin S precipitates and cell aggregate may block some small blood vessel leading to necrosis, etc. So sickle cell anemia. This is the sickle cell anemia. This is sickening. This is normal RBC, shape of the RBCs, but this is the crystallized hemoglobin containing RBC that is crystal shaped, and crystals may destroy the cell membrane as well. And so this is again the crystal shaped RBC. This is RBC, crystal shaped RBC. Hereditary spherocytosis, you know this word, I have used it in previous lecture today as well. That is, this is the one of the congenital anemias. RBCs are spherical instead of biconcave cells, and they are fragile, easily decrease deformability. I have explained in the previous lecture as well, and they cannot withstand compression, and they are easily destroyed. So hemolysis will occur, destruction of RBCs will occur. So hemolysis in the tight vascular beds, and the RBCs are destroyed easily. And then these are the spherocytes. This is circular, round, ball-shaped cells. They are easily destroyed when they pass through the spleen. And then thalassemia, abnormal. This is again abnormal hemoglobin. This is also known as Cooley's anemia or Mediterranean anemia. Impaired alpha or beta chain synthesis due to the genetic abnormality, of course. It is genetic. And the alpha thalassemia and beta thalassemia. Alpha thalassemia decreased defective or absent chain, and there may be an excess of gamma chain. बीटा चेन अल्फा चेन के बजाय गैमा चेन बनती रहती है. And beta thalassemia more common and decreased defective or absent beta chain. So this is the excess of alpha chain precipitates in hemopoietic cells. So this is the thalassemia is abnormal type of hemoglobin. So some clinical features. So these 6 types of the hemoglobin. I have classified the anemia into these 6 types. It covers all the types of the anemia. So common clinical features, patient को कैसे नजर आता है? It is beyond our scope, but one we can list it. For example, pale skin, lips, conjunctiva, these eyes, they are not red, normally red, they are conjunctiva, and mucous membrane, and the chylonychia, the spoon-shaped nails I have talked about. So this is an increased heart rate and COP and murmurs. What is that? When hemoglobin, the person is suffering from anemia, oxygen has to be supplied, and their blood has to pump very quickly to supply the oxygen. So heart rate is more. Cardiac output, amount of blood pumped by the heart in 1 minute, that has to be increased. And there may be some systolic murmurs as well during this. So anemia, severe anemia does cause some abnormal sound production. So these are the features of anemia. There is increased respiration because of the deficiency of oxygen. The respiratory center is also stimulated, and the respiratory rate is increased. The person is breathless. Anemic person, थोड़ा सा walk करे या वैसे भी the person is breathless. And loss of appetite. There is nausea. There is vomiting. That is anorexia, nausea, vomiting is quite common in anemia. Headache. Lack of concentration. Oxygen supply is deficient. Irritable. The person is irritable. Lethargy, deficiency of energy, deficiency of energy, loss of energy. So lethargic, lack of energy, that is, lethargy means lack of energy. Fatigue, easy fatigability, tiredness, etc. And the menstrual disturbances in females, that is maybe menorrhagia, painful menstruation, menorrhagia, or oligomenorrhea, deficient menstruation, or amenorrhea, maybe sometime absence of the menses may occur. So some features of the anemia. So next time, inshallah, we are going to talk about the next formed element, that is WBCs or leukocytes. We are going to track. Thank you very much, and hope you are following me. And if you are not following me, you can ask the questions in my comment section, and the subscribe and share. I have for a few months I was away, and now I'm going to deliver the lecture regularly, inshallah. Every week I will deliver 3, 4, 5 lectures, inshallah ta'ala. I hope to see you in next lecture, inshallah.